Edgar's mission, really, by their nature, sees some pretty extreme cases. So for them to call me out, this must be a case that is out of the ordinary. She doesn't have hooves.
No.
I can categorically say I've never seen anything like this before, not even close. I'm on my way to see some old friends. Now, these guys aren't just friends to me, they're friends to so many different animals who really need help.
Chris is responding to a call from Pam Ahern, who runs Edgar's Mission, an animal sanctuary located about an hour out of Melbourne.
Hello, Pam. How
Chris,
are you?
how you doing?
Hey, good to see you.
Good to see you.
Now, I can't wait to see what you've got for me.
Oh, it's a special one, this one. I've
Yeah.
never seen anything like it before, Chris.
Okay. All right, which way is he?
Up here, she's still in bed with her friends.
Yeah. Edgar's Mission, really, by their nature, sees some pretty extreme cases. So for them to call me out, given the fact that the staff here are pretty good at what they do, this must be a case that is out of the ordinary. She doesn't have hooves.
No. A bit of a technical hitch here. When I say she has a hoof problem, it's actually she doesn't have a hoof problem because she doesn't have a couple of hooves. This one and that one, she doesn't have any hooves. This one, she only has one toe. As you know, they normally have two toes, like a little back foot there. So we only have one toe here and nothing on these ones. She has little
Wow.
stumps. Oh,
So, on the right side, she has no hooves at all.
that's right. Yeah.
Left side, the back, she has a hoof, but here,
Yeah,
this one's
it's a
not
funny
even right
one.
either.
That's right, yeah.
I can categorically say I've never seen anything like this before, not even close. The way a hoof normally works is it's kind of like a shoe. You have a protective outer layer, like the rubber in a shoe, and you have the inner layer, which is the cushioning, like the foam. With Charity, she has the foam, but no rubber. This is a severe case. Well, the thing is that her feet like that, she's going to have lameness probably every week of her life. And as you know, with sheep or any sort of ruminant, they can't lie down. If they lie down, they die. They have to be upright, moving around, feeding, for their gut to work, for everything in their body to function. So lameness isn't an option for her.
Clearly she can't go on the way that she is, and we need to find her something that will actually give her a quality of life so she can get out there, run around the farm and enjoy life with her other sheepy friends.
Can I just see her walk?
Yep.
I'd love to actually see what we're up against here.
Come on, Charity. Come on, Charity, come on. Come on, girl.
She essentially hops onto that back left leg, supports her while she very gently tiptoes across on those other legs.
Good girl.
She's a brave girl.
She is a brave girl. She wants to live.
Yeah. I mean, I want to give her every chance, but it has to be worthwhile for her. I mean, she's got to have a good quality of life. And my worry with her and the way her feet are is that being lame and sore and uncomfortable and not being able to walk across grass or rocks, that's not a life for a sheep.
No, that's right. It has to be a life worth living.
It does.
Yeah. It has to be a life worth living.
The rather sobering reality is that without any sort of help for Charity, this lameness would only get worse. She's struggling now, and she's young. So you can imagine, given a few months, years if we're lucky, she wouldn't be able to move around. And for a sheep, it means she doesn't survive. There is something that I've seen done, and I've seen it done overseas. And I don't want to get your hopes up about this because I'm not even sure if it's something we can do. But how do you feel about looking into prosthetic hooves?
Wow. You reckon that'll work?
Well, we've kind of got no other option because there's nothing else that's going to be firm enough to support her on rough ground.
Yeah.
Otherwise, she's going to be like this, down on her front, for the rest of her life. And that's not a life.
No.
My worry is that I may have spoken too soon because the fact is, unless Charity is fit and well enough to really get through the next few years, then there's no point putting her through prosthetic hooves.
Charity. Oh, where you going?
These joints here They're actually pretty good. And it's the same in this one. She's got young lamb legs. I think she looks healthy enough for us to try.
Good. Good news, Charity.
Because what I'm suggesting isn't going to be easy and isn't going to be something that she can adapt to straight away. It is still going to be a lot of hard work. It's not a magic fix. But she needs to be up for the fight.
We'll do everything we can to help you, Charity.
I'll make some phone calls, okay? Is that okay with you? We'll see what we can do.
If Chris's plan works, it will be the first time prosthetics have been fitted to a lamb in Australia. And for Pam, it's going to be an anxious wait.
Charity is incredibly important. We have over 300 animals here at the sanctuary at the moment, and every one of them is important to me. We have to give them a life worth living, and this is really what we have to do for Charity.
So do you have to break it to them? They all can't come along?
Oh, I think you can break it to them, Chris.
It's a travelling band, isn't it? Support network,
Yeah,
family.
well, just like us, they like friends.
Yeah.
Chris has returned to Edgar's mission in country Victoria with good news for Pam and her beloved lamb Charity.
Oh, more sheep.
Chris and Pam are now heading to a specialist vet who can help fit the lame lamb
Timmy, you better
with
go in
prosthetic
front.
hooves.
I guess the good thing about being a vet for a few years is that you have built up a few contacts. Finally, I find someone that actually does this work in Australia. The prosthetics are still made in the US, but the first step can be done here.
Hold on.
Timmy the sheep is coming along to provide support for Charity.
You don't see this every day. The moral support sheep in the back of the ambulance for sheep.
Charity and her best friend Timmy are now on their way to the vet practice in Whittlesea, where the first stages of making the life-saving prosthetics will take place.
In order for prosthetics to be successful, they have to be modelled exactly to the specifications of the individual patient. So today, it's all about creating a cast. From there, they can make a mould and make these hooves.
Charity.
Come on, girl.
Go, Charity.
Here we go.
Good girl.
It's like dogs and cats, aren't you? Go to the vet.
Good girl.
Hey, Lisa, right?
Hi.
Hey, how are you?
Good.
Good to see you. Now, this is Pam.
Hi, Pam.
Hi, Lisa. Pleased to meet you.
And obviously, this is Charity right here.
Hi, Charity.
Dr. Lisa Weldon will be carrying out the first stage of Charity's prosthetics.
So, thank you so much for putting us in.
No problem.
Now, where do we need to head?
Come this way.
Okay. Go on, girl.
Charity.
Go on. This is all good. Let's go.
Charity's an unusual case. We've not put prosthetics on a sheep previously.
If Timmy was in front, he should walk.
What I love is that even though Charity is a sheep, the moment she walks into a vet clinic, she's just like any other dog and cat. Puts the brakes on, doesn't want to move. But that's where the moral support sheet comes in. Enter Timmy.
That's the way. Follow Timmy. Follow
This is
Timmy.
why you have Timmy.
This is why we have Timmy.
With Charity happy to be guided by her best buddy, Lisa can now begin the first steps in developing the prosthetic hooves.
Just going to need some photos.
You just need her standing naturally, is that it?
Yeah.
Yeah. Charity needs photos taken of each leg, front and to the side. By doing that, they work out exactly how a legs stand in a normal position. This information is crucial.
So once we start wrapping,
Yep.
if everyone that's gloved, we just need to rub it down so it sticks to itself.
We've got fairly limited time once that fiberglass goes on.
Well, to get it stuck and shaped, yes.
The casting has quite a few steps. First of all, the leg is wrapped in plastic, really to protect it from the fiberglass. This really is going to form the framework of the prosthetics.
All right. So we need to get this up into the angle that she lives at. Yep. Gonna open it. We're at 105.
It's the same angle as in the photo.
Yep. So we need to make sure we don't have any rotation.
We have to get this right because this artificial hoof has to fit like a glove.
Now that should come off. Beautiful. One done.
One sheep foot. She almost looks normal at that angle.
Just missing some feet.
So the other leg now.
Other leg now. 140.
The angle is there.
That's the right angle. We should be right.
It's not exactly a normal situation for a sheep to be in a dog and cat vet hospital on a table, having a cast put on, yet she's asleep. Wow.
Yep, we're finished.
Yeah.
Apparently we have.
So she says.
She knew, didn't she?
Yep.
Everything's happened pretty quickly today, but now we have casts that we're very happy with. So even though your eyes were shut, you were watching, weren't you?
Yeah, she knew.
You knew when it was up. So you happy with that, Lisa?
Yeah, I think that's good.
Yeah, great. From here they get sent off to the US to be measured up and turned into prosthetics. It's probably the trickiest part now, the waiting, but hopefully in a few weeks we get a good result. So once we get Charity's magic shoes from the US, we'll be ready to go.
Right, look forward to it.
Yeah. See you later.
Go on, sheepies.
Hello.
Hi Chris, how you doing?
Big day's here, huh?
Yeah, big
Good
day.
to see you.
Good.
Good.
Got the crew?
Of course.
It's been 6
There
weeks
we
since
go,
the
Gil.
plaster casts of Charity's deformed legs were sent to America.
Bit of a trade up on those shoes today.
Today, the 7-month-old lamb finally gets to try on her new prosthetic
Charity.
hooves.
Come on,
Come on, girl.
come on.
It's trade up time.
Come on, Charity. Timmy might have to lead the way.
Come on, Timmy.
Go on, Timmy.
We've been really anxious about today. The days have been building up and it's a big day for Charity and hoping it's all going to go well. A lot's riding on today.
Hey, Lisa, how you going?
Good.
Good to see you.
See you.
The anxious wait's over.
Hope so. Hope they fit.
Well, don't tempt fate. They're going to fit. They have to fit.
All right, come on through. I suppose the difficulty with this is going to be how easily does she manage to put up with new feet. I have no idea how it's going to go.
All right. It's time to reveal a new look.
Let's get it going.
So the socks go over first, I guess, just to avoid any rubbing.
Well, to make cleaning easier, they've made them without the padding.
Yep.
Put the socks on to be the padding.
Okay, so we lock the back piece in, then we get the front on.
Which almost hinges on.
Okay, so we're on.
All right.
You ready
Let's
for your first
see.
steps?
Ready.
It's going to feel strange. You ready, Charity? There you go.
This is the critical moment, and everyone is on edge.
Wow. She's almost reaching out, searching for it,
Well, it's
because she's
gonna
just not
be
used to having that
a few
foot there.
centimetres taller than she used to be.
Yeah. She's taking big, exaggerated steps, first of all, just to almost find her feet. But then, after a few laps, she's got it. It's incredible.
It's pretty good,
It's
isn't
quite
it?
an adjustment. I mean, she is that much taller. And she reaches out almost to test if that's really there, but she
I've
finds
seen
a
dogs
feet.
put them on and shake and be bothered by them, and she's just chilled about it.
It's a positive start for the young lamb, but now for an even bigger test.
All right, you ready? Let's go.
This pack hoof is posing a lot more problems simply because it has that joint there that mimics the hock, the ankle in the sheep. That has to be right, otherwise she just won't be able to walk normally. Little clips in there.
Sticks there. This one's Velcro. How does that one feel?
Look at you, huh? You're a bit fancy now, aren't you? Wanna give it a try?
That one's a bit more serious.
Yeah. This is really the critical moment because she has to adjust to the new way of walking, and she has to do it quickly.
Not quite sure where her legs are.
No.
Charity is struggling to adapt to the second prosthetic.
Yeah, it's taking some getting used to, isn't it?
Oh my God, she's got it.
Wow, what a difference. You know who's the biggest help in all of this? Timmy.
Timmy's been fantastic, hasn't he?
Yeah, he's just providing that inspiration to walk.
She got to know that sensation of her feet being where they were meant to be, but she walked into it beautifully. Oh, I'm just so proud of my sheep. I really am just so proud of Charity.
Hey, Charity,
Well, my
you
friend.
look incredible. You do. You look amazing. The way you're walking, extraordinary.
But before the celebrations can truly begin, the lamb has one final test.
So she's mastered the concrete. I think it's time to see how she goes in the real stuff, back on the farm.
Good walking.
Charity is now home at Edgar's Mission, where she's about to try out her new hooves.
This is really a big moment because we need to see how these new hooves really tolerate the real world. A paddock with ups, with downs, with soft parts, with hard parts, and with grass. Something she's never done before on these hooves. There's a little welcome home party over here.
Oh, looks like a bit of pace up. Look at that. Charity, she's nearly running.
The fact is, all the animals here at Edgar's Mission are so incredibly fortunate to have Pam in their corner, because without her, they may have never had a second chance. Well, it looks like these new hooves have opened up a whole new world. Look at her. She just cannot get enough.
It's just wonderful. We can't thank you enough, Chris, for getting this outcome for our very special girl.
Well, you're the reason they're here, and you're the reason they actually have a second chance, so the thank you goes to you.
Shucks. I am a little bit overwhelmed today to see Charity from where she came from when she first presented to us with the hooves missing, to see her now. I've been able to fulfil my promise to her that I would give her a life worth living. I didn't think it was really achievable to start with, but we've done it. It's a great feeling.
It was a surprise when we saw it. It looks like she's sort of seen a ghost or something. It looks really terrible.
2-year-old Ali has been brought into SASH with a frightening case of bulging eyes.
I don't like the thought of any, problems with blindness. We wanted to get it fixed up straight away.
I must say I've never seen anything quite like this. Wow, that's unbelievable. When did this all come about?
Probably a week ago.
Okay, and what happened?
She just started to get a little bit of white knock in the corner of one eye.
Oh, she's looking at me so startled.
I know, it's a
Pretty
bit of a shock,
bizarre.
isn't it?
I've seen animals that have inflammation in other parts of their muscles, but I've never seen it affecting the muscles around the eyes. I know if it was one eye affected, then I wouldn't be as shocked, but the fact that both eyes are like that, I mean, she looks like a Google-eyed fish.
She does. Yeah, she does.
She doesn't seem to be in any pain. She seems like she can see. I really need to get an ophthalmologist to have a look at this one.
Off you go. You're all right, Elle.
Come on, sweetie. Look, I see another doctor. Look at this dog's eyes.
Oh my God, you poor sweetheart. Hello, darling. Do you know what it is?
No, I'm going to go try find Kelly and see if she can tell me. I've never seen anything quite like it. What do you think of the eyes?
It's a bit scary,
Amazing. It is.
Ali's bulging eyes are the talk of the hospital.
It's fantastic.
This is actually a really interesting medical case. I've never seen anything quite like this.
Miss Ellie, do you think we could take a look at these eyes of yours, huh?
Fortunately for the Labrador, eye specialist Callie Caruso isn't as shocked as the rest of the staff.
She's got a nice response to the light. Well, I think the key with her is her age and her breed. And this is the immune system attacking the muscles that surround the eye, inflaming them and making the eyes bulge forward. An extraocular polymyositis. What these dogs typically present is non-painful, visual. They look really kind of creepy, but we usually can fix them, and we can put her on some oral steroids and a little lubricant in these eyes, and I bet she's a new dog.
These little blue tablets are going to make her look a lot better within about 72 hours.
Oh, great.
Which is a pretty quick turnaround. It is. She says, I will be beautiful in a few days, Mum. I promise I'll have my beauty back.
You're beautiful anyhow, aren't you?
I will never forget that look of surprise on Ellie's face when she walked in the door with her eyes bulging out of her head.
See you later. I'm just glad to find that they can treat it. So that was a good thing. A really big load off our mind. She'll probably get a big cuddle, big hug. maybe a treat.
Come on, sweetie, come on. Good girl, good girl, good girl.
At a nearby park, Angus is taking his 8-month-old puppy Rosie for a walk.
I can tell the little flippers start to get tired.
Every day, that's becoming harder and harder for this severely deformed golden retriever.
The problem with her paws has deteriorated. I can see that she's finding it more difficult to walk on those paws.
2 weeks ago, Angus saw an ad selling the dog for $100. He soon found out why she was going so cheap.
I knew something had happened to her paws. I wasn't sure whether it was trauma or maybe a congenital thing. The owner at that time told me that he hadn't fed her properly, and so I was perhaps wondering whether it might be rickets.
Despite her disability, Angus fell in love with Rosie.
I think it was a case of love at first sight. She chose me and I chose her. In terms of Rosie's future, she certainly can't exercise as a normal dog. She can't get upstairs, and I just think those things are going to get worse.
Following a check-up at the Bondi Clinic, Rosie has been referred to the Small Animal Specialist Hospital, SASH.
Come on. So I'm determined to do what I can for her. Good girl, Rosie. Good. Nice to meet you, Andrew.
Nice to meet you. Come on in.
OK, sure. And this is Rosie.
Look at those legs.
Good
Come on, let's have a
girl.
look at you.
At the Bondi Referral Hospital, SASH, Angus meets specialist surgeon Andrew Marchevsky to see what can be done for Rosie's deformed legs.
What you're going to find with her is we'll end up putting some frames on her legs and essentially breaking a leg or cutting it, the bone, which will allow us to sort of gradually straighten it out and lengthen it. But as I say, we'll take some x-rays and we'll see. It's serious in the sense that I think it's life-threatening if it goes on for much longer. She won't be able to walk around, she'll be in chronic pain, and from an ethical point of view, you just wouldn't be able to keep her alive.
X-rays show Rosie has a bone disease which has damaged her growth plates. This is an extreme case.
The good side about all this is there's something we can do. The downside is it can be quite expensive.
Yes, yes.
And I think your $100 dog is going to turn into something a little bit more than that.
How am I going to get the money together for this operation? A very, very good question, but I'm going to have to talk to family and friends. I'm going to have to go into debt.
Oh.
Okay, see you, Rosie. See you later.
Come on, Chookin. You and me. Come, Rose. Good girl. Good girl.
You know, it's a lifetime commitment taking on an animal, and it's something now that I feel I have to take some responsibility for.
Rosie's major surgery is about to begin.
In a month or so, she wouldn't have a life because she just wouldn't be able to walk around. This surgery will be life-changing for her.
Her owner, Angus, has managed to come up with the $6,000 for this complex operation.
All right, let's go. When I'm actually breaking her leg or cutting the bone, that's got to be just right.
During this extreme operation, Rosie's front legs will be broken.
If you were a human, you'd be in hospital for weeks after this. So it's very major surgery, especially for a young dog. So we're just about to put the frame on the bone.
Metal rods will be drilled through both legs into adjustable frames. Rosie's legs will then be slowly realigned and straightened.
In a couple of days' time, we'll start winding this. And so that will take that angle of that ring from there, like that, and that will also change the angle of the leg from that to that.
It's not enough for Andrew to be a specialist surgeon. He has to be a whiz in geometry as well.
That alignment's pretty good. So that's about all right height-wise, so drop it a bit. Very fiddly work, yeah, but you can overdo it. You sort of become obsessed with making it look perfect, and it's just not going to happen. I've learnt that. I'm not perfect.
2 hours later, and Rosie's new leg frames are finally in place.
So now what I'm going to do is break this radius so that we'll be able to straighten the leg out gradually over the next couple of weeks. 3.5 hours later, and it's gone very well. I mean, this part of it's finished, absolutely, but as I said, Angus's part starts now.
Rosie's epic operation is over. Her deformed legs have been broken. Now her long road to recovery begins.
She's going to be sore, so we'll be making sure that she's got plenty of pain relief on board, that she's got plenty of padding around the pins and the leg. You grab me the bolt cutters, please.
Yep.
The metal frames on Rosie's legs will need to be adjusted every day for the next 3 weeks. It will then take the fractured legs another 6 weeks to heal.
A long journey for Rosie and Angus. To be honest, I think Rosie will probably cope with it better than Angus will, but we'll see.
Oh, wow. Rosie.
Hey, Rosie, who's here?
Oh, Rosie.
So we just want to... She gets stuck. You just need to sort of move her little...
Despite being warned, Angus is shocked by Rosie's condition.
I'm a bit spun out, to be honest with you. God, she's been through a lot. Oh, no. Sorry. I didn't expect to cry. I don't cry very often, so I'm sorry. Okay. You're handling this better than me, darling. That's... I bet you weren't last night, though. You're a good girl, Rosie. You're a good girl. Oh, darling.
At SASH, Rosie is back on her feet.
She's a great little patient, and she's lovely and great temperament, and she's a good candidate for this sort of surgery because she is so accepting. You're not a lightweight, Rosie.
Her legs are now being straightened in metal frames, and surgeon Andrew is about to show Angus how to adjust them at home.
I've got a little wrench here which you're going to have to take home with you. You're going to be a bit of a rig of war, aren't you?
Now, I've got to go clockwise,
That's
so
right.
going this way. So
That's
I've got
right.
the one there, so
Yep.
if I just... 1,
Yep.
2...
And you've got to make sure you're going the right way. Sounds a silly thing to say, but you don't want them getting worse.
Yeah, okay. Here we go. Here you are, Rosie. Time to go home. I'll just clean up that little wound a bit.
At home, the convalescing Rosie is getting around-the-clock attention.
Good girl.
Angus's other dog, Gus, keeps a constant vigil by her bedside.
Sometimes I find myself smiling because she looks like she's got little, floaties on it. So, and that's the truth. It's just, it's really weird sometimes. Sometimes you feel very sad, and then sometimes you have to smile. Like that. Rosie, good girl. As each day goes by, I'm seeing a little bit of an improvement. I don't think she's in a lot of pain, so that's been a real relief for me too. Rosie.
It's been a day full of drama, and it's not over yet. Scott's now on the road following up a call from a popular city farm called Mudshoot, right in the middle of East London. Scott's patient today is one of Mudshoot's smallest residents.
Right, so Nick, I think Papa's down this end?
That's right, he's in with the other rabbits at the moment.
Okay, how's he getting on?
Well, he's okay in himself, but he does have this recurrent problem with his teeth, which keep regrowing like crazy.
Gosh, I can see them. They are some massive gnashes, aren't they, right now?
That's right, and that's only about 2 weeks growth since they were last clipped, yeah.
Wow. OK, well, let's have a closer look, shall we? So when I saw Papa, I was pretty shocked. You don't very often see teeth on a rabbit that look like they should be on a rhinoceros.
OK, so now getting hold of him may not be entirely straightforward.
Yes, that's always the reason that rabbit owners are late to the vet. I'm trying to catch them.
I'm happy to leave it to the expert.
Oh, here we go. Good boy. Hello, mate.
That's a professional at work.
Here we go. Wow. They are impressive, aren't they? They're almost like tusks.
It's not a great look on him, is it? Let's be honest. And, of course, it's going to interfere with his eating, isn't it?
They were pretty substantial and exceptionally abnormal. You certainly want to be careful to take your eye out.
Papa, he wasn't a planned acquisition. He came to us when he was dumped in a hedge. basically, along with another rabbit. So they've been living with us ever since. And we use both of them in our animal handling, which is when we get kids visiting and they like to actually get up close and stroke a rabbit. But we get people kind of calling the RSPCA saying, hey, you've got a rabbit that's in a terrible state. And we have to explain, no, we haven't. We're trying to manage it, but there is this chronic problem.
So the problem he's got is a problem called malocclusion. As you know, rabbits' teeth continue to grow their entire life. And in this instance, they're not rubbing against each other, so they're growing and growing to the point where they're forming almost jail bars. He can't eat when they're that long. He's picking up dirt and muck off the floor when he is trying to eat. And of course, that's going to mean eventually that he's going to lose weight and have health issues. So it is something that we do need to intervene on. This guy, you're trimming his teeth about every 2 weeks.
Yep.
And you've got to think, over the life of a rabbit that's probably 6-8 years, that's a lot of trimming.
Yep.
And I think actually the best option for him is to try and get those removed. The ones we're going to remove are incisors. They're actually the catching, the nibbling teeth. They're really not important from the point of view of chewing teeth, which are the molars at the back. So all we're going to do is remove the jail bars and get that guy eating again. Gotta be brave there, mate. You gotta get a beautiful smile. This is certainly not beautiful right now, is it?
No. If we were unkind, we could post some pretty freaky pictures of him.
Yes.
It's absolutely fantastic news if Scott can help us out with this, because, as I say, we've got the financial problem of visits to the vet every 2 weeks kind of adds up, and the welfare issue that, poor Papa is suffering from these huge and weird teeth.
Okay, so we should pop him in there ready for a trip to the clinic. There you go, buddy. Good boy. So now it's time for Papa and me to take the long journey back to the clinic. But as it's pretty late in the day, I think what's best is he comes home with me. And I know 3 very excited little people that are going to wake up to a lovely bunny in the morning.
So Goldilocks was very hungry, but very naughty. Can you feel the porridge on there?
Girls, look what I've got.
Where's his teeth so long?
You know how you've got your baby teeth and you're ready for your big girl teeth? Well, when you get your big girl teeth, they stay the same size. But rabbits keep growing and growing and growing. So you know what Daddy's got to do? He's got to take his teeth out.
Oh my goodness.
My kids are massive animal lovers, and it doesn't take much to get them overexcited, particularly fluffy things.
Oh, well done.
Let's see. No.
It was love that changed the life of this Aussie vet. He met his English wife Zoe on a blind date.
I'd had, a few heartbreaks and decided, you know what, I'm giving up on that and I'm just going to get a dog. Much, much simpler. But then realised, wow, having a cute puppy really helps pulling girls. And we had an amazing first date, and the rest is history. Is he cuter than Daddy?
Yes.
Oh, get out of it. That can't be true with those teeth. You're joking.
I still love you, though.
Oh, thank you, sweetie. All right, should we let him have a little hop about? There we go. Queen, you sit there, that's it. Zoe and I got together and then actually moved out to Portugal. And then just as we found out we were pregnant with our first child, we decided that actually we wanted to come home to be able to be around Zoe's family. So we came back to this lovely area of southwest London, which is just glorious. Bye-bye, beautiful. Bye. Okay, see you later.
I saw his butt.
You saw his butt? Oh, dear. All right, little man. All good? Hey, Ems.
Hi.
So,
What have we
here's
got?
that little chap from Mud Shoots, Papa, the rabbit.
Hello.
Have a look at the gnashes on him.
Wowzers. Not seen any like that. Hello.
It would seem that just taking a rabbit's teeth out shouldn't be much of a problem, but actually it's quite a big job. You've got very delicate bone structure around the outside, and those teeth go in just as far as they come out. Alrighty, so anaesthetic time.
Rabbits are very, very tricky. They can die very quickly under an anaesthetic. Their heart and their lungs are under a lot of pressure. He's starting to go. He's starting to get there.
They actually use a huge amount of anaesthetic. Sometimes the volume that you give a small animal like Papa, you give to a large dog. So it does make it quite difficult and also quite dangerous. Look at that. I mean, look at the size of those.
Let's try and get his temperature and stuff nice in
What
the
we might
meanwhile.
actually do is, why don't we give it a little bit of gas?
Nathan's assisting with the procedure,
Oxygen.
but he's having some trouble taking Papa's temperature.
We found it. Nathan was having a bit of issue there finding the rabbit's bum hole.
You'd be worrying if you found it really quickly. I don't blush. Excellent.
Oh, luminous.
See, I can't say rude
Luminous
things. I
red.
can't say rude things.
You know, the tensions are so high and Scott does get quite stressed out. So if we do try and, you know, relax everyone a little bit and mention anything slightly naughty, it does get a bit funny and Scott just blushes and goes luminous red. We find it quite funny.
But the laughs are over when Scott starts having problems intubating Papa.
Yeah, I think what I'm going to have to do is burr these down first because they're just getting right in my way. I just can't push things down far enough. So after numerous attempts, I literally cannot see in order to place the tube. So I need to pull out the big guns. I grab out the power tool. I help to grind down those teeth just so I can see where I need to go, which is down his airway. There we go. Right, let's try tubing again. So, Nathan, rabbit all good?
Yeah, breathing nicely.
Now I can see what I'm doing.
Hey.
Yeah. Good stuff. Lovely. Okay, well done, everyone.
Oxygen's on.
When you're approaching a dental like Papa's, you do need to mine the resource of patience because he had very strange curved roots. And so although we have to put a bit of force there, at the same time we have to be so gentle because there's so many important structures all around those teeth. So yeah, it made me sweat a bit. Okay.
Those bad boys.
That's one. 3 more to go. You've seen how long the roots are. It's not something that is lightly undertaken.
Number 3.
These teeth are actually the more dangerous to remove because they go right up into his nasal passages. Okay, look. No wonder that was difficult to come out and see the curve on that. It's like a letter C. It's exceptionally delicate. I mean, I've got a very sharp instrument here and his brain is only there. So, yeah, it's...
It's a little bit nerve-wracking at this moment in time, isn't it?
I think to say the least.
Yes.
That's it. Done.
I can breathe again now.
Okie dokie. I think a few sutures and then we'll let this boy wake up. So to get all those teeth finally out of Papa's mouth is a massive relief. We're done. Great, well done, team. Good job.
This boy up.
Come then, buddy. He's off. Look at that.
Doesn't he look handsome now without those big things in his face?
It does. Really beautiful.
It is very important that we now get Papa eating as soon as possible. Rabbits have such a high metabolic rate that if they don't keep the food processing, they can get what's called gut stasis. Their guts actually stop working, and we need to avoid that. You can quite figure out how to do this without your teeth. I'm hoping that he's going to take some of the food that I've put down for him. Otherwise, if he doesn't eat anything now, then he will unfortunately have to be force-fed and get a syringe in his mouth.
Hey, Papa. What are you doing?
Next day, student vet nurse Jess is trying to tempt Papa to eat after his drastic dental work.
Papa's beginning to get used to eating without his incisors. We're giving him softer food so that he doesn't have to chew it, unlike his hay and stuff. But he still is eating it, and he's eating a lot of coriander now, which is a great sign that he is doing a lot better. Good boy, Papa.
The bunny is now ready to go home and see his friends at Mudchute Farm.
And here's Jess with the little guy. Hello, mates. Here we go. Let's go back to Farmer Nick. There we go.
Wow, let's have a look at you. What a difference. I think he's looking handsome, normal, and healthy. So it's great to have him back, looking so good.
That's right. No longer looks like a wild boar.
Yeah, let's get you. Wow, that must have been quite a business getting those out.
It was, actually. It was really pretty difficult. I mean, you can see this is an example of the one that we took from the bottom jaw. So, of course, the best thing was to have them out. And he's eating well, he's bright, and I think it's a happy future for Papa.
Great stuff. I was kind of expecting big teeth, but nothing quite as amazing as that. They look like they come out of a warthog or a walrus or something. He's already been missed in the couple of days he's been here because He's one of the most popular rabbits with the kids. Kind of, as you can see, incredibly friendly and relaxed, despite all the things he's been through. So,
well, I can believe that. It was exceptionally popular with my kids. Right then, mate. Farewell. Nick, I don't know if you have any use for teeth.
Yeah, I'm sure the kids are going to be very interested to see those. Thank you.
Pleasure.
I'll put him back in his box.
Back off to the farm.
Yeah.
All right.
Sure is.
All the best, Nick.
Great.
Take care.
Thanks, then,
Bye.
Scott.
See you.
Cheers.
See you later.
Bye.
Bye-bye.
Hey, fine. How you doing? How's everything? Nova. Yes.
In Atlanta, Georgia, an anxious Nova is waiting to see Arvid with her family, James, Skylar and Chandler.
Hey, you want to go home, don't you?
Hey, good morning. How you doing?
Well,
Dr. Edward.
Jamie.
Nice to meet you.
Nice to meet you.
This is Nova?
This is Nova.
Nova. How you doing? She's like, oh my gosh, what's going on?
I already know.
The 9-month-old Labrador has been brought in after her owners noticed a strange lump growing inside her mouth.
And it started off really small, Dr. E.
It was like a marble size, and then it grew to like a kiwi size.
Wow. So Nova came in today because the owner noticed a large growth under the tongue. They said it started the size of a marble, but grew to the size of a kiwi fruit. And they were right.
You can see it protruding
underneath
there.
Oh yeah, you can feel it. Yeah. Oh yeah. But I'm sure that scared you. You thought it was probably like another alien coming out of there or something, right?
Exactly.
There we go.
Good girl.
Over here. It's okay. Nova. It's okay. It's okay. It's okay to be scared. I know. It's okay. But yeah, you can definitely feel this large, soft fluctuation there, which tells me two things. One, that it's not an abscess because of how it feels, and that it's not a tumor. Okay? So it's not that.
There you go, girl.
Yeah, you can definitely see the big bubble right here. Yeah, that's pretty big.
Yeah.
That's pretty big. So as I'm looking under the tongue and I see this large, soft structure, I immediately knew that we were dealing with a salivary mucocele. What that means is that the saliva has formed in a pocket of this tissue. That results from a damaged or a torn salivary duct that's coming from the salivary gland.
Okay.
All right? It can happen in a number of cases. Like a choke collar, like if you have a choke collar on her and she's constantly pulling, that can cause a damage or a rupture. A foreign body, like chewing on a stick or a toy, you say that's probably what it is.
Probably what it is.
That's probably what it is.
I'm sure that's probably what it is because she puts everything in her mouth. She puts everything in her mouth.
So this salivary mucocele that's in Nova's mouth needs to be addressed, and it needs to be addressed immediately because these mucoceles can get very large and occlude the airways, making it a respiratory distress and a very serious situation. If that happens, it can become a life-threatening situation.
Okay.
We don't want to get there.
Definitely not. Definitely not.
All right, so we're gonna get this bubble taken care of, and then I'll be in touch with you to let you know how everything went.
Okay.
And we'll get her home. We'll get her home today.
Sounds good. Thank you.
Absolutely.
Thank you.
Yeah, I feel good. I know my dog's gonna be fine. The dog gonna take good care of her. It's my pup.
So we don't want Nova in any more pain or discomfort than she needs to be, which is why I'm gonna go ahead, get her in surgery today, and get this salivary mucocele taken care of.
All right.
Let's see.
Oh my goodness.
See that? And all that is just full of saliva. So, we need to get that thing out of there. What were you chewing on, huh? You're not gonna tell me?
I don't know.
You're not gonna tell me? Doing surgeries on pets like this is very rewarding, but in Nova's case, because she's so stinking cute, that's another reason why I'm glad I'm able to help her. Don't get me wrong, if she wasn't stinking cute, I'd still help her. But she is stinking cute. All right, we're gonna make you feel better. Yeah, we'll make you feel better.
But before the much-needed surgery can start, there's a problem with the anaesthetic.
Once the initial tracheal tube was in Nova, she kept waking up. It's a bad tube. I could definitely hear a defect, almost like there was a hole in it. We have a defective tube. Putting another trach tube in. We got a new one in. Everything's good. So here you can see the mass right in her lower jaw region, which we call the mandibular region, but it's just full of saliva. Yeah, this thing is getting big. It looks like it's getting big by the minute.
The surgery involves two parts. First, Arvid must remove the salivary gland from Nova's lower jaw.
About to make my incision. The problem is that it's really close to the jugular vein, so you got to be really careful because you don't want to cut the jugular vein. As I'm in there trying to get the salivary gland out, I see the jugular vein right to the side of it, and I knew that I had to be very careful. Just taking your time, working your way down. If I was to cut that jugular vein, that could be game over for Nova. We're getting there. You can see the gland is just starting to work its way out of here. And there's the gland and the duct.
The next step is to take out the saliva-filled bubble under her tongue.
Can you go ahead and hook that up, suction up for me? Yes. I'm gonna make an incision into the bubble, if you will, and I'm gonna suture or stitch the areas of the tissue to the sides of the walls of the tissues in her mouth. And that's gonna leave that mucocil or that bubble open, and it's gonna heal from within. The tongue is a very vascular area, which means it bleeds a lot. As I get in her mouth and look under that tongue, I still can't believe that she was walking around, eating, drinking, playing with this large mucocil under her tongue. So we're gonna throw one more suture in and then I'll be all done. Now that the surgery's over, it's time to recover Nova, get her up and ready to go so she can go home and be with her family tonight.
So my dad and my sister are pretty busy, so I came to get my dog over. So hopefully she's doing well after the surgery, so I'm really excited to get her when she comes back.
Always want them to look nice before they go home. Here comes Nova. This way, this way, right here.
How you doing? You got the cone on your head?
Surgery went well. No complications, went pretty straightforward. And we want to leave that cone on pretty much till the sutures come out.
Okay.
You're gonna go on to live your normal life now. Yeah? I know. The surgery was a success. Nova's gonna heal up and go on to live a normal life, just as long as she leaves those sticks alone.
Good girl, come here. I'm Dr. Kate Adams and welcome to Bondi Pet, a new destination for pet health and well-being. Our site is filled with everything to fulfill your pet's needs so that you can make healthy choices for your pets.